trying to get your child into regular physical activity from an early age and encouraging them to do that consistently is a really, really important life skill from a social perspective, from a mental health perspective, and from I guess a broad physical health perspective. And then more broadly for society, as you have a healthier population overall. The sports that are beneficial for children are the ones that they'll do. So everybody has their own preference. Those preferences will sometimes come from their siblings, from their parents, but the most important thing is they enjoy it. So if they ever get to a stage where they're feeling like they want to move away from a certain sport or start trying other things, then I think encouraging them to do that is important. And giving them a bit of time away from sport periodically as well, and particularly through adolescence when we get growth spurts and changes in body shape, body composition. It takes a little while before the athlete gets used to using that body, that we don't want to be doing too much, and you want to be able to facilitate a couple of rest days every single week. Essentially, we have two ends of the spectrum. We have a group of children who don't participate in sport and are sedentary, and that we need to nudge towards it. On the other end of the spectrum, you have athletes who are playing maybe multiple sports for multiple teams. Making sure there are a couple of days where they're not playing sport each week is important. That allows recovery for the individual to make sure that the risk of injury is lowered. When you have young athletes who are very good, they are asked to play a lot by a series of different coaches. So actually beginning to prioritize and ultimately learning to say no to coaches sometimes is an important skill for the child and the parent to support them in. Training tips from anybody, anywhere in the world might look cool on Instagram, but it might not be applicable to that individual. So I think guarding against poor information or controversial information maybe is probably one of the more challenging areas. And that's where seeking out a strength and conditioning professional is probably a better approach than purchasing a program from an online practitioner somewhere in the world. The big thing I would say when you go along to watch sports as a parent is to just let them play. You're not there to coach, and the way they play isn't a reflection on you as a parent. So bringing them there and leaving them alone, I think, would be a recommendation. Being able to try to find a balance between fostering competition and social participation is challenging. For coaches, when you have a larger team, maybe a squad of players that is a lot bigger than the amount you can get on the pitch, and particularly with the younger age groups, then rotation is important. Giving everybody a chance to shine and not just putting the best players on the pitch. If 90% of your players are still playing in their 20s, that's a far more important statistic than winning more games when you're 14. In terms of guidelines for trying to ensure safety for children that would apply to any field sport, so ensuring the right level of coaching experience and ensuring good warm-ups prior to training are probably two big pieces of safeguarding children. I think we've had a change in our environments where free play and physical development has been curtailed. And because of that, children don't get the same exposures to jumping, landing, running, falling that maybe previous generations might have. And then we parachute them into organised field sports at a later age, and they don't have the physical literacy to be able to do that. And that increases the risk of injury. Last year, we saw a 50% increase in ACL surgeries here at UPMC Sports Surgery Clinic. And that's not just because of market share. I think there has to be some changes in the athletic preparation prior to playing field sport. We have professional players coming in to visit us for testing and rehabilitation. If you are 50 years old and have a sore knee, you will undergo the same testing processes. If you're a young athlete, same thing. Our thought process here is that we should be applying the same principles that we do for the elite athletes to everyone.